Welcome back to our channel. In today's video we will discuss colorectal polyps, their causes, signs and symptoms, diagnosis and treatment. A colorectal polyp is a growth or small clump of cells occurring on the lining of the colon, which is a part of the digestive tract. Polyps are common, and most colorectal polyps are not harmful. However, colorectal polyps are important because they may develop into colorectal cancer, which is deadly in nature. Polyps grow in two different shapes, sessile and pedunculated. Sessile polyps have no stalk but are attached to the lining of the colon by a broad base. They seem to lie flat against the wall of the colon and can blend with the lining of the organ, making them sometimes tricky to find and treat. Pedunculated polyps are shaped like a mushroom and are attached to the lining of the colon by a long, thin stalk. Both sessile and pedunculated polyps can turn into precancerous and cancerous polyps. Cancer risk increases with the size of the colorectal polyps. The smaller the polyps, the less likely they are to turn cancerous. The most common types of colorectal polyps are adenomatous polyps, which are the most common type of colorectal polyp and the most common cause of colorectal cancer. Nearly all malignant polyps begin as adenomatous polyps. The likelihood of these polyps developing into cancer depends on their size, number, and growth pattern, tubular, villous, or serrated. Hyperplastic polyps are the second most common type and have little or no potential to become cancerous. In some cases, hyperplastic polyps may coexist with adenomatous polyps. Inflammatory polyps occur in people with inflammatory bowel disease or IBD. The exact cause of colorectal polyps is not known, but it is believed that they develop when cells grow and divide abnormally. Risk factors include obesity, age, 50 years and older, smoking, a history of colorectal polyps or colorectal cancer, uncontrolled type 2 diabetes, inflammatory bowel disease, like Crohn's disease or ulcerative colitis, and genetic conditions such as Lynch syndrome, familial adenomatous polyposis, Gardner's syndrome, Poitz-Jeghers syndrome, and MYH-associated polyposis. Most colorectal polyps don't cause symptoms. However, if symptoms do exist, they may include abdominal pain, iron deficiency anemia, which can lead to lightheadedness, weakness, fainting, pale skin, or a rapid heart rate. Other symptoms might be black stools, bloody stools, rectal bleeding, increased mucus production, and a change in bowel habits that last longer than a week, including constipation or diarrhea. To diagnose colorectal polyps, a doctor will review your medical history, assess risk factors, and perform a physical examination. If polyps are suspected, further tests may be recommended, such as a colonoscopy to examine the colon, flexible sigmoidoscopy to examine a limited portion of the colon, a stool exam to check for blood, and virtual colonoscopy, which uses X-rays and a computer to make pictures of the colon from outside of the body. The goal of treatment is the removal of polyps. Treatment options include colonoscopy to remove polyps, laparoscopy, a minimally invasive surgery, and partial or total proctectomy. This procedure involves removing the colon and rectum and is only necessary for severe conditions or cancer. Healthy habits that can help prevent the development of colorectal polyps include consuming a diet rich in fruits, vegetables, and fiber-rich foods like beans, peas, and high-fiber cereal. Maintaining a normal body weight, limiting red meat, processed meats, and foods rich in fats, and avoiding or quitting smoking are also crucial. Thank you for watching our video on colorectal polyps. If you found this information helpful, please like and share the video. Also, don't forget to subscribe to our channel to stay updated on our latest videos.